Digital security, swift response, smart progression. Welcome to Qingqiao Safety Investigation. According to Yonhap News Agency, the South Korean Congress recently passed the Medical Care Bill, which will allow physician assistant nurses to legally practice medicine starting in June next year. This change means that medical assistant nurses can perform some tasks traditionally done by doctors, potentially helping to address the medical gaps caused by ongoing tensions between South Korea's medical and political sectors. Earlier this year, the South Korean government decided to increase the annual enrollment quota for medical schools from 3,058 to 5,058 starting in the 2025 academic year. This decision aimed to address a potential future shortage of doctors due to the aging population. However, it has been met with resistance from the medical community. Doctors are concerned that the increase in medical school admissions will lead to an oversupply of doctors, intensifying job competition and affecting their income and career prospects. Additionally, interns and residents already face high workloads and low salaries, which could exacerbate the situation. As a result, South Korean intern doctors, resident doctors, and some senior doctors at the specialist and professor levels launched a large-scale strike. This strike severely disrupted South Korea's medical system, leading to emergency rooms suspending patient admissions, delayed surgeries, and even patient transfers to hospitals in other cities. The strike has made it more difficult for patients to access medical care and lowered the overall quality of services. In response to the strong protests from doctors, the South Korean government made some adjustments to its enrollment expansion policy. The planned increase was reduced from 2,000 to 1,509 students, and designated colleges were given the flexibility to adjust their quotas by 50% to 100%. However, these changes have not fully appeased the doctors, and many have not returned to work, continuing to strain the South Korean medical system. In this context, South Korea passed the Medical Care Bill, which aims to improve the status of nurses and address the medical gap. The Korean Nurses Association welcomed the bill, seeing it as a significant step toward establishing a comprehensive nursing system and achieving universal health insurance. They believe it will improve the quality of nursing care, enhance the occupational status of nurses, and improve working conditions by ensuring the proper training, dispatch, and accountability of nursing staff. However, the Korean Medical Association, the largest doctors group in South Korea, criticized the bill. They argue that the government's approach is creating discord among hospital staff and could ultimately harm patients. The association is concerned that the bill could lead to widespread illegal, unlicensed practice, confusion about the scope of work, and a chaotic medical industry, with the consequences being passed on to ordinary citizens. Some analysts pointed out that South Korea's passage of the Medical Care Bill represents a significant reform of the medical system, aimed at addressing the doctor shortage, enhancing the professional status and working conditions of nurses, and standardizing medical practices. However, the bill also faces controversies and challenges. Ensuring the quality of medical practice by nurses will be a critical issue in the actual implementation process. Tune in at 6 a.m. from Monday to Friday for Qingqiao Safety Investigation for your daily safety updates.